Hi, in this video we are going to see about aphasia, which is an important question that can be asked from the portion language and speech. This is commonly asked as a short essay question wherein you will be asked to define and classify aphasia, or it can also be asked as an answer briefly question like what is fluent aphasia or what is non-fluent aphasia. Okay. So first we'll see about how to approach the answer. So you have to start the answer with an introduction or which can include the definition of aphasia. So what is meant by aphasia? It is a disorder of the language function of the brain due to lesions in the higher cortical centers in the dominant or the categorical hemisphere. Okay. So basically due to lesion in the higher cortical centers, your language function is affected and that is called aphasia. So what are the causes of aphasia? It can be stroke, head injury, degenerative conditions or malignancy, whatever that can affect the language speech areas in the brain in the dominant hemisphere. So then we can just draw a diagram to show the different language speech areas in the brain. So you can draw the outline of the brain to show the different Brodmann areas. So we've got area 22 which is called the Wernicke's area. Okay, and this is the area which is responsible for comprehension. And near the Wernicke's area, we've got another area called the angular gyrus, which is also important for advanced comprehension, like in order for naming, in order to identify what the written language is. So for that, we need the angular gyrus. Then another important area is area 44 and 45, which is the Broca's area, or also called the motor speech area. And in certain books we see that there's another area called the Exner's writing area, which is important for writing. So if this area, if there's a lesion in this Exner writing area, you will not be able to write even if your small muscles of the hand are intact. Okay. So these are the different areas, and also we've got this fibers connecting the Broca's and the Wernicke's area, and that is called the arcuate fasciculus. Okay. So in this, the angular gyrus and the Wernicke's area is called the receptive areas because when we say something, we hear it and we have to comprehend it. So this comprehension occurs in this Wernicke's area. Similarly, when you show a written language, that comprehension occurs in this angular gyrus. Okay, so this is called the receptive areas. And Broca's area and external writing area is called the executive areas because when we have to express ideas, we can express it either through speech or through writing. So this is the executive areas. Okay. So now we'll move on to the types of aphasia. So we'll describe each type based on the area affected. So the first type is Wernicke's aphasia. So obviously from the name itself, it means there's a lesion in the Wernicke's area. So where is this Wernicke's area? It is present in the upper part of the temporal lobe, that is area 22 of the dominant or the categorical hemisphere, and it is a major association area for processing sensory information. So it is essential for comprehension, recognition and construction of words and language. So the Wernicke's area is important for comprehension, recognition and construction of words and language. It is the Wernicke's area that decides which words are to be used. So, when there is a lesion in the Wernicke's area, it is called Wernicke's aphasia. And in this, comprehension and repetition of spoken and written language will be impaired. Why? Because Wernicke's area is important for comprehension. Now, so in this actually, the person will not be able to comprehend, but he'll be able to speak fluently. Hence, it is also called fluent aphasia. So, if you ask the patient something, he'll be talking even though it won't make any sense. So that is why it is called fluent aphasia. Okay, and the person might also use neologism. Neologism means new words which are not actually present. Okay, so they'll just construct words according to their whims and fancies, and that is called neologism. And paraphasia means telling words which are not intended for that meaning. Okay, so basically the person will be talking but it will not be sense, and that is why it is called fluent aphasia. Okay. Now we said that there's another area near the Wernicke's area which is called the angular gyrus. So if there is a lesion in the angular gyrus, there will be conditions called visual aphasia. What is visual aphasia? It is the inability to comprehend meaning of written words. So suppose something is written and then if you have to comprehend the meaning, you need processing at the level of the angular gyrus also. Okay, so that is why if there is a lesion in the angular gyrus, there will be visual aphasia or word blindness. Similarly, you will not be able to name anything, and that is called nomen aphasia. So the inability to recall name of a familiar object. So for such patients, if you show a cake, they'll just describe it as something sweet or something which he likes, but he'll not be able to say the word cake. So that naming function will be affected if there is a lesion in the angular gyrus. Next is Broca's aphasia. So Broca's aphasia obviously means there is a lesion in the Broca's area. And where is this Broca's area? It is present in the frontal lobe and it is area 44 and 45. And this Broca's area is involved in the motor aspects of speech. That means it regulates the functions of the muscles of the lips, tongue, pharynx and larynx. So to say each syllable, we need specific contraction of muscles of the lips, tongue, pharynx and larynx. So that regulation is done by the Broca's area. So if there is a lesion in this Broca's area, we'll have what is known as Broca's aphasia. So since Broca's area is concerned with this articulation speech, the person can comprehend but will not be able to speak. That is why it is called motor aphasia and also non-fluent aphasia. Why is it called non-fluent aphasia? Because the person will not be able to speak fluently. So in this, the person can comprehend when spoken to but cannot form words and speak, right? So that is called Broca's aphasia. Next, suppose both this Wernicke's area and Broca's area is affected, we get what is known as global aphasia. That means both Broca's and Wernicke's is affected. So what will happen? Comprehension as well as speech is affected. So the person will be completely unable to speak. Okay, so that is meant by global aphasia. So next type of aphasia is conduction aphasia. In conduction aphasia, repetition is severely affected, and this is because there is a lesion in the arcuate fasciculus. So what is arcuate fasciculus? It is the band which connects the Wernicke's to the Broca's area. So the coordination, that means after it is comprehended in the Wernicke's area, that information has to be sent to the Broca's area for proper output. So here when this arcuate fasciculus is affected, you will have what is known as conduction aphasia, wherein repetition will be severely affected. So to summarize, we first said about the different areas of the language and speech. So basically there are two types of areas. One is the receptive areas, which includes the Wernicke's area and the angular gyrus. And then we have the executive areas, which include the Broca's area, which is area 44 and 45, and also the external writing area, which is responsible for the writing. And then we've got this arcuate fasciculus, which connects the Wernicke's area to the Broca's area. Okay, so these were first we just mentioned the different language speech areas, and then we went on to describe the different types of aphasias based on the areas affected. Okay, so first when the Wernicke's area is affected, we'll have what is known as Wernicke's aphasia. Then if the angular gyrus is affected, what will happen? There will be visual aphasia as well as nominal aphasia. Then if the Broca's area is affected, we'll have what is known as the Broca's aphasia. And then if both are affected, we'll have global aphasia. And finally, if the arcuate fasciculus is affected, we'll have what is known as conduction aphasia. So with this, I hope this concept is clear. Thank you.